when she was diagnosed, she weighed 65 pounds. She was now down to about 41 pounds. And we had been in the clinic the day before, and I said, "Can you do anything?" Like, the girls had just, we had just redone their room. She didn't want to sleep in their room because she was throwing up. She was embarrassed. She would make it smell like just, would wreck the whole vibe of the room. So she was with us. And I said, "Can you do anything?" And they're like, "Well, we're going to have to increase the, maybe we'll do 10 hours or 12 hours." I'm like, "How is she going to wear this to school?" And they're like, "She's in school." I'm like, "Oh, yes, she's in school," like, and so I, I pulled Erin aside. I'm like, "I'm going to lose my mind. All they think about, they're just myopic. All they think about is cancer." I'm like, "If we could get the vomiting to stop, then maybe I could get her to eat something, because I know they're going to talk about a feeding tube. I know they are, I can feel it." And so, and then, then the just not feeling good, and her worries were sky high during that time. And I'll never forget, you're like, "I'll be right back." You walked down the hallway, you came back, you gave us a prescription for amoxicillin, because you said sometimes
Oh,
weirdly,
erythromycin. Yeah, yeah.
erythromycin, sorry,
Mhm.
erythromycin. And then you gave us, um, you called, um, why am I blanking on her name? Joanne Lindell, right?
Yes.
You called and got an anti-anxiety medicine for her. And then we went on medical marijuana that day. One conversation with Erin turned into 3 new prescriptions. The erythromycin worked that night. That night, she didn't vomit. The next night, and so 24 hours, she doesn't vomit. 48 hours, she's back in her room. Within a week, she doesn't have to have the TPN anymore. We went on her Make-A-Wish trip, went on her Disney cruise. She gained 4 pounds on that cruise, 10% of her body weight. She came back and continued to gain weight. And she got up to 56 pounds because of Erin, and and then draws that picture of herself. So that day, like, that's another day you changed our lives. Like, I, I don't know. I'll never forget that day. I was so, I just could not get them to listen. And you said, "Look, they'll deal with, they'll deal with cancer. I'm her pain doctor.